but we've mostly been talking about treatment, although Hank really talked about is there a difference, and I'll just mention that. I really just want to make just a few points about the regulatory issues that are raised here. And if let me see if I can change this slide. I don't see any. Oh, okay. So there's two. I'll try to be brief. I realize I was late. There are really two sections of the law that I want to talk about, which I think are relevant and I think will help answer some of the questions that some of the other panelists have already raised. So obviously the whole drug development enterprise depends in part on what the legal definition of a drug is. After all, that's what we regulate the development of, and so it's important to know what the law says about what actually are we talking about. So these are the relevant parts of the law that talk about what is a drug, what do we regulate. Well, there are articles intended for use, as you can see in the diagnosis, the cure, the mitigation, the treatment, the prevention of disease, which is mostly, of course, what it is we deal with. But it's also articles other than food intended to affect the structure or function of the body of people or other animals. So really here we see in the law the fact that a drug can be something that is just intended to affect the structure or function of the body. It doesn't have to be a disease. It doesn't have to be an abnormality that we are treating. In other words, people can develop drugs to treat normal function. Now, I have to say, at least in my experience, it's extraordinarily unusual for this to happen, but the law certainly permits it, as you can see. The other section of the law that I want to just briefly mention is